So this was a young woman with pelvic pain, and oops. So this was her left ovary over here. And she has a history of polycystic ovarian syndrome. So you can see that this left ovary looks polycystic, multiple small follicles. And then the right ovary, you can see, is markedly enlarged here with all of this edema centrally. And there was kind of like a torse pedicle here. So we thought this was a torsed polycystic ovary with massive ovarian edema. And so they went to the OR and detorsed it and pexied it. And so what I learned about was massive ovarian edema, which I didn't know was an entity in itself. Apparently this is from partial torsion. So you get like sort of a more chronic partial intermittent torsion, eventually leads to venous and lymphatic engorgement and lack of outflow. And it's mostly lymphatics actually that collect here. And it can actually cause, I wrote this all down, stromal luteinization and precocious puberty and virilization, because the lymphatics end up stimulating the stromal cells. And so then you can actually get hormonal changes. So this is not like as much of an acute torsion as it is chronic intermittent torsion leading to massive edema, which can lead to hormonal changes. And I thought this, and the treatment is, to kind of detorse and pexy the ovary. And on the post-contrast, it wasn't like devascularized or anything, and it actually is so low, kind of low grade, that it does not lead to necrosis of the ovary. So this was the ovary.
So if they treat it, does it resolve, like after they pex it?
I think so, because it's not partially torsing anymore. Does anyone else know more about this entity?
They are, from what I remember, they're generally very bright on T2. So, yeah, and there will never be any arterial obstruction, only venous and lymphatic, as you're mentioning. So how about the other ovary? Is that, looks morphologically, it's not enlarged, but looks pretty similar on T2. So
yeah, well, she had a history of PCOS. And so that's what I thought the other ovary was.
Just PCOS and no, there's some, is it just some edema in the central stroma, or is it just stroma itself?
I don't know. I didn't upload the other series here, so I can't really look at the T2 with the FATSAT, but I thought it was just the PCOS stroma. But you're saying maybe this one also has intermittent? Yeah. Yeah, maybe. And then I read in one place that it's like this massive ovarian edema can also be on the PCOS spectrum, like it's seen more commonly in patients with PCOS. So it kind of like overlaps with their hormonal issues.
So is that the size that predisposes to this, or what is this?
I don't know. I got really confused reading about it, because it like also was saying like the lymphatics can actually cause some of the issue. Like it can cause the engorgement, which causes like this change in VEGF, which causes a stromal stimulation, which causes enlargement of the ovary, and that can then lead to the torsion that can make this worse. So I'm not really sure what comes first.
Okay.
But yeah, I thought it was interesting. Like if you Google like massive ovarian edema, it's like you're saying you see these huge ovaries online with like a lot of them are very T2 hyperintense. But it's not like this acute situation, and that's why the ovary can get so big, because it's happening over a large period of time.
Incredible.
And then my other case